hyperdyadically, moving, cascading through the network, affecting people more broadly. And this is a credible supposition, we think, since emotions serve an evolutionary purpose. Why? Why? Ask yourself two questions. First of all, ask yourself why we have emotions. You can think of some reasons. And then ask yourself another question. Why do we show them? Like, why do we show our anger and our fear and our joy? Why don't we just have them as internal states? Well, it doesn't take a lot of sort of reasoning to figure out that one reason we show our emotions is if I all of a sudden see that my colleague over there in my chimpanzee troop is afraid, he's probably seen a predator. And it would be to my tremendous advantage to get afraid quick, too, because I need to emulate what he's doing. It's a kind of communication that's taking place between us, okay? And also because these emotions can serve to integrate the function of the group. If we all have a similar emotional state, we can work together to achieve something. So we show the emotions so others can copy them, can know what's going on within us. And in fact, what we did when we looked at the Framingham Heart Study social network, we had data on whether or not people were happy or not. They had collected this data fortuitously because they were interested in depression, in heart attacks, and they had the CESD, a measure of depression, of which there's a validated subscale of 4 items that reliably measures happiness. So we just bumbled into this, good fortune. And here we colored the depressed people, the unhappy people blue, and the happy people yellow, and the people in between green. And what can you see again? Clusters of happy and unhappy people within the network. And so for us, it's a kind of like, this image that we have now is that there's a kind of social fabric, and there's this kind of endless yin and yang kind of fight between happiness and unhappiness within humanity. There's this kind of blinking. We want to see, like, does the happiness spread out? Unhappiness is also spreading. Do they reach at this kind of borderline between the two of them? Kind of, and does this thing migrate around the unhappy network, or does it kind of oscillate? Does it kind of blink in and out, and that this sort of niche stays permanently unhappy? Do you understand? So we're very interested in this idea of the spread of happiness. And we did similar analyses. We found that your happiness is associated with the happiness of people that are up to 3 degrees removed from you, people you might never know. If your friend's friend becomes happy, it affects whether or not you become happy, not just if your friend becomes happy. And we found that opposite gender, we found that similar analyses to those that we did earlier document that there is induction in happiness. And we found, interestingly, that opposite gender alters are significantly less influential than same gender pairs. So you're much more influenced by the happiness state of concordant sex individuals than discordant sex individuals. We also find that happy people have higher network centrality. They're more likely to be located towards the middle of the network, have larger networks, have more friends, and are located in larger clusters of other happy people. So they're much more likely to be embedded in a kind of happy space. And these results are all the more remarkable when you look at the effect of alter happiness and how it decays in distance and time. So there's something that Danny Kahneman and some other people that study happiness, Dan Gilbert and some psychologist colleagues of mine, it's called the hedonic treadmill. The hedonic treadmill is this idea that, right now if I asked you how happy would you be if you got an A+ on the physics test, or if you won the lottery, or if, your partner was really nice to you, and you say, oh my God, I'd be really happy if that happened. And then if those things happen, and you are really happy, but only for a while. After a while, you return to your baseline level of happiness. And what this is called the hedonic, meaning happiness, a treadmill, because we constantly need more things to make us happy, right? It's, we get something, it makes us happy for a while, and then we return to our previous baseline. So what we find, in fact, is, so we adapt to the happiness. And what we find is that this shows the increase in probability of happiness if alter is happy. We find that if your friend becomes, or your social contact becomes happy, and if it happened less than 6 months ago, less than half a year ago, it increases your probability of being happy by 40%. If it happened less than a year ago, by 25%. And if it happened a year and a half or more ago, it's no longer statistically significant. You don't care anymore. Oh yeah, what else is new? My best friend got happy. That's fine. That's old news. Okay? So it doesn't affect you anymore. We also looked at distance again, and here we find something very interesting. This shows the increase in probability of happiness if alter is happy according to how far away the alter is. And what we find is that the alter has to live within 2 miles of you. unlike the obesity results, something about interpersonal contact seems to matter. So if your friend who lives 1,000 miles away gets happy, it doesn't affect you. But if your friend lives next door, it does seem to matter. So these kind of constraints on the spread of happiness, these temporal and geographic constraints, make the clustering that we see all the more remarkable. So to sum up a couple of slides, there are many conceivable or documented examples of the spread of health-related phenomena operating at the dyadic and, we think, hyperdyadic level. This slide just shows a variety of what we also call collateral health effects, work done by us and by others over the years. One of the most famous examples, of course, is since 1858, is the widower effect. The death of one spouse increases the risk of death of the other. Other work being done in the last 20 or 30 years looks at caregiver burden. Illness in one spouse worsens the health of the other. Depression treatment in parents could affect the health of their children. If we take better care of parents when they're depressed, they might provide better health care to their children. So we can improve the health of children by taking better care of parents. Illness in children increases the risk of death in parents. Some beautiful work done by Scandinavian researchers a few years ago. Hip replacement in one spouse might reduce the disability of the other spouse. If I replace my dad's cataract, his wife might be happier, right? Or his wife might be more able to do stuff because I fixed his cataract, not her cataract. Stroke prevention in one person might benefit others. Better terminal care reduces the risk of death in a spouse. Some work we did looking at a sample of 200,000 couples, we found that if you take better care of me when I'm dying, if I have a good death rather than a bad death, it attenuates the widower effect. It reduces the risk of death in my partner. Breast cancer in one person could prompt mammography in others. Well-known thing. Your woman gets breast cancer, all her friends run out and get mammograms. Heart attack in one person prompts weight loss, smoking cessation, exercise, or aspirin use in others. This actually touches on a point that Juliet and I, Dr. Shore and I, were just discussing earlier, which is that taking the embeddedness of people in networks seriously can also lead to some very counterintuitive, counter-normative, and problematic results. Here's why. Let's say I were to drop dead right now. It would probably put the fear of God in lots of you. And a bunch of you might make big changes in the way you live your lives. You would lose weight, start exercising, eat better, and so forth. And I might have lost, let's say, 30 years or 35 years of life expectancy, my actuarial survival. But each of you might have gained you 6 months, you 3 months, you 2 months, and so forth. And if we added all those months up, it might actually be good for society if I drop dead. All of you might start doing things that are better, and it might contribute to a positive gain at the group level, even though for me it was negative. So if you look at this idea, heart attacks can improve behaviors in others, it can actually begin to lead to some very kind of provocative implications. Some work done by some colleagues at University of Washington, beautiful work looking at seatbelt use, found that seatbelt use by one person saves the lives of others. Here the argument is when you get in a car and you buckle your seatbelt, the reason you should tell everyone else to buckle their seatbelts is not so much because you care about their lives, although you might and you should, but rather because if they're unbuckled and you're in a collision, their body becomes a projectile. It flies through the vehicle, hits you, and kills you, even though you fastened your own seatbelt. So getting people to fasten their seatbelts, it creates benefits for other people around them. Alcohol, smoking, weight loss, or medication behaviors can spread, and emotional states or other health statuses might also spread. The fundamental fact that people are embedded in social networks and connected to others has a number of consequences. It means that health, healthcare, and health behavior have specific interpersonal collateral effects. It means also that what is known in social science as externalities, but strictly speaking here, health externalities can arise. So the classic example of an economic externality is the industrial polluter, right? The factory pollutes the environment, and that cost is borne by the people that are downriver and is not reflected either in the balance sheet of the company or in the price of the widgets that are being manufactured. Or the other classic example is you go home and you fix up your yard, you spend a lot of money on landscaping, and your neighbor's property value goes up. Strictly speaking, you should go and tax your neighbor to recover part of this value that you created. That's an economic externality that you've created. But what I'm interested in is health externalities, how what's done to me or what happens to me affects the health of other people around me. And because of all this, it means that social, clinical, and policy multiplier effects may result. And by multiplier effects, I mean that the health-related occurrences can arise as a result of the existence of social networks and can have cascade effects within social networks that spread out from and back to the relevant individuals. Behavior changes, clinical care, and policy maneuvers can have